Hi, my name is Shelby Wages. I'm going to be discussing circumcision care and umbilical cord care for our nursery checkoffs. So for our circumcision care, we're going to want to make sure we're paying special attention to educating our parents. So we would come in, introduce ourselves, make sure we have the right baby by confirming the identity with their wristband or through their parents. And then we want to put on or perform our hand hygiene and then put on gloves. So the first thing we're going to do is make sure our parents know when to clean the area and how to clean it. So they would make sure that they're cleaning after every time they change the diaper. So they do this with warm water and a towel just to make sure it's dry. And again, after any baths, they want to make sure the area is dry. We'd also want to make sure that they know that they could apply petroleum jelly to the site to promote tissue healing and to help prevent any bleeding and to help prevent the diaper from sticking to the site. We also want to make sure that they pay special attention to the baby's voiding, and that if voiding stops, they should contact the healthcare provider because it's a sign of a complication. We also want to make sure that we are documenting the first voiding after the procedure. And then we also want to make sure that we are managing the pain of the baby, also the parent too. We do this by giving usually Tylenol or whatever the healthcare provider prescribes. We also want to make sure that the patient or the parent knows that there will be some yellow exodus that pops up within a few days, and that this should not be removed or washed off. That they could apply petroleum jelly to that as well. And then some granulated tissue can be, it usually pops up at the site, and that should not be removed as well. We also want to make sure that we're teaching them to assess for any signs of infection, which would be swelling and redness or any abnormal discharge. And if they are finding these things, they should contact their healthcare provider. And then with the Plastibell circumcision, we want to make sure that they know that they shouldn't apply petroleum jelly, and that the bell usually falls off on its own within 3 to 4 days. If it hasn't fallen off within 8 days, they need to contact the healthcare provider, and probably they would need to assess and remove from the baby. And then we want to, for our umbilical cord care, for the circumcision too, we'd want to make sure that the diaper is being applied appropriately. So it shouldn't be too snug or too loose. If it's too snug, it could attach to the site and obviously cause some irritation. And then if it's too loose, it could cause some rubbing on the area. And then for our umbilical cord care, again, we're going to want to introduce ourselves to the parent, explain what we're going to be doing, paying attention to our education. We would put on new gloves, wash our hands, put on gloves. So a clamp is usually put on the umbilical cord shortly after birth. The clamp is usually removed 24 to 48 hours afterwards to promote drying and to prevent any tension injuries. So we want to make sure that the parents know that they need to promote drying in the area by not immersing in water. So for any bathing for the baby, we want to make sure that they're not immersing in the water, and that they're drying around it appropriately. So they would be doing a sponge bath. Also, we would want to assess the umbilical area after removing the clamp, or before putting the clamp on, that there's 2 arteries in 1 vein. We want to make sure that the parent knows not to be pulling or to try to remove the umbilical cord. It's very important that it falls off on its own. We also want to make sure that we're assessing for any signs of infection, which would be any edemas, abnormal drainings, any foul odor, or anything of that nature. Those need to be documented right away. Again, it should all be, we should promote dryness. And then we want to make sure that our parents know not to put the diaper on as to where it is rubbing the area. So we want to make sure that they're rolling that down a little bit so it's not rubbing the umbilical cord area.
Hi, my name is Shelby Wages. I'm going to be demonstrating my swaddling, suctioning, breastfeeding, bottle feeding, and burping techniques for our nursery checkoff. So whenever we swaddle a baby, we do this because it stimulates being in the womb and it comforts them. So we would have our baby lying on our blanket with it in a diamond fashion. So first thing we're going to do is take this side of the blanket, make sure our baby's arm is up, and tuck it underneath them. Okay, and then we're going to take the bottom part and tuck it underneath that. Alrighty, and then we're going to go ahead and take this side and wrap it all the way around our baby. Okay, so our baby is swaddled. So if we were coming in to do our suctioning, we would knock, introduce ourselves, perform our hand hygiene, get our identifiers from the parent, just so we know that it's the right baby. And then we're going to also explain to the parent what we're going to be doing, and we want to be teaching the parent how to do the suctioning. So we just want to make sure we're explaining everything. So I would make sure I had my napkin in order to dispel the mucus from the suctioning device. So when we go in to do our mouth suctioning, we're going to depress the suctioner like this before sticking it into the baby's mouth. So we would insert it about 1 inch, and then we would let go, collecting all the mucus, and then we would dispel it onto our napkin. We do one side and then do the other side. And then for our nose, we would go ahead and have the baby laying kind of on their side. And then again, we would make sure we decompress it first and then do their nose, spell it, and then do their nose. Okay. We would do this until everything was cleared. And then we would make sure that the parent understood what was going on and how to do that. So we would also want to make sure that we rinse this out with soap and water, and we would let it air dry. Okay? So if we were teaching a mom how to breastfeed, we would start off teaching them about how to help introduce the baby to the nipple. So we have our different techniques for that. So we have our cupping technique, which would be a U-shaped, and we do this and then set by the baby's mouth. And then we have our C technique, and then our scissoring technique. When the baby is breastfeeding, we want to make sure we tell the mom that the forehead and the chin need to be touching the breast, and that to watch for their cheeks to make sure they're not collapsed in, and the cheeks should be full. This shows that the baby is sucking properly. So for our holding techniques for breastfeeding, we have the cradle, which would be like this. And then we have our modified cradle, which we bring the other arm around for extra support. And then we have our football, which would be like this. And then we have our side laying position, which we would be laying down on the bed and have the baby next to us like this. We want to make sure that the mom knows that if the baby was crying beforehand, that she would go ahead and burp the baby, just to make sure all of the air that they might have had going due to the crying was expelled. We also want to make sure that the mom knew to burp the baby every time switching between breasts. And then for our bottle feeding, we want to make sure that we test the the formula in the bottle or the breast milk in the bottle, and make sure it wasn't too warm to the skin. We test it with our wrist. And then when we're feeding the baby, we want to make sure that we have them in a 45-degree angle. And we also want to make sure that the formula or breast milk is covering the nipple so the baby's not getting in too much air. And then for our bottle feeding, we want to make sure the mom, again, knows to burp the baby if they had been crying beforehand, and after every 2 to 3 ounces in between feedings, she would burp the baby. We also want to make sure that we want to make sure after feeding our baby that we would have them sitting up for 10 to 15 minutes after to reduce reflex and spit up. We would have a burping cloth too, just in case. And then to burp our baby, we would have them like this, and we would pat their back until they burped, or we could be sitting and we would have the baby like this supporting their chin, and we would pat on the back. And again, we want to make sure that we're burping after every feeding, before if they had been crying, in between breast changes, and after every 2 to 3 ounces if they were eating from a bottle. And we want to teach the parent to go ahead and make sure that they recognize the feeding patterns of their child so they're not going too long in between feedings. And that's all for our swaddling, suctioning, and breastfeeding and burping.
Hi, my name is Shelby Wages, and I'm going to be demonstrating my newborn physical assessment today. So the first thing we want to do is come into the patient's room, introduce ourselves, perform our hand hygiene and privacy. We're also going to make sure that we identify our baby by checking their wristband and asking the parents for their identification. We'd also want to explain what all we're going to be doing today. So after that, we would go ahead and take our baby's measurements. So our baby's length should be anywhere from 48 to 52 centimeters. Their weight should be anywhere from 5 pounds to 8 ounces to 8 pounds, 13 ounces. And then we're going to go ahead and check the circumference of their head, which should be anywhere from 32 to 36 centimeters. And then we're going to check that at their brow bone and around the widest part of their head. And then their circumference of their chest, which should be anywhere between 1 and 2 centimeters less than the circumference of their head. And then after that, we're going to go ahead and take their vital signs. So a baby's blood pressure, the systolic blood pressure should be in between 50 and 70, and then the systolic blood pressure should be in between 45 and 30. And then we're going to check their respiratory rate, which the respiratory rate should be in between 30 and 60, and then their pulse could be anywhere from 110 to 160. If they were crying, it might be up to 180 for their pulse, and then their respiratory rate might be a little bit higher as well. And then we're going to check their temperature, which should be in between 99.7, or I'm sorry, 97.5 to 99.5 to 97.7. And then after we get their vital signs, we're going to go ahead and assess their skin. So we want to make sure that we're keeping the baby covered as much as possible because their body can't maintain their temperature as well as adults can. But we want to make note of the skin color, make sure it is normal for their ethnicity. We also want to make sure that we're assessing for any yellowness that could indicate jaundice, or any blueness around their fingers, toes, or mouth, which could indicate cyanosis. We'd also want to make sure that we document any rashes, lesions, birthmarks, or Mongolian marks, which would be found in darker ethnicities. These are important to document because a physician later on could think that they're caused from bruising. We also want to make sure we explain to the patient's parents that the lanugo, which is thin like hair over the baby's arms and body, that would fall off within 4 months. And then any ventrix, which is a cheese-like white substance in the folds of the babies, should come off in between after their first bath. And then we want to make sure we assess their turgor, which we could do that by pinching the abdomen and making sure that goes back within a normal time. So after we assess the skin of our baby and we document, we're going to go ahead and assess their head. So they have anterior fontanelles, and then a posterior fontanelle. The anterior could be there as long as 18 months, and then the posterior could be there as long as 12 weeks. They can also have capsules or capits, which those can cross the suture lines and they should go away within 12 hours. And then they could also have cephalohematomas, which don't cross the suture lines, but they can last up to 2 to 3 weeks. And then we also want to make sure we're assessing the shape of the baby's head. If they were birthed vaginally, they could have their head could be a little bit cone-shaped, but it should go back to normal soon. And then we're going to go ahead and assess the face of the baby. So our baby's eyes should be symmetrical. We're going to assess the sclera, make sure that it's white. And then if there was any yellowness, that could indicate jaundice. And then we're going to assess the conjunctiva, which should be pink. We're also going to assess their pupillary reflex, make sure that they're dilating symmetrically. And then we're going to go ahead and assess our baby's ears. They should be even and symmetrical, and they should align with the outer canthus of the eyes. We also want to make sure that they're pliable. And then we want to make sure that there's no signs of infection or anything of that nature. And then we're going to go ahead and assess the nose, make sure it's midline of the face. We can assess the patency of the nose by occluding one side at a time and making sure the baby can breathe through both nostrils. We also, when checking the baby's mouth, we're going to want to make sure we're wearing gloves. we want to make sure that the mouth is midline in the face and symmetrical, and that the lips are pink. And then we could go ahead and insert a finger into the baby's mouth and make sure that their sucking and swallowing reflexes are working properly, and also that we're assessing the soft and hard palates of the mouth to make sure that the baby didn't have any cleft palates. We also want to make sure that they don't have any Epstein pearls, which are we could feel them in the mouth, or we can just look and see. We want to make sure that the parents know that that's normal and they'll go away on their own. So after we've done that, we're gonna go ahead and assess the baby's chest. Again, making sure we're covering them up as needed. So we want to make sure that the nipples are close to 8 centimeters apart, and then that the sternum is 8 centimeters long. We want to make sure that they're symmetrical and that the baby's breathing is even and symmetrical as well. I'm then going to just go ahead and assess the umbilical cord and make sure that there's no signs of infection or swelling, to make sure that it's drying normally. And then we're going to go ahead and auscultate for lung sounds. We're going to do this with the bell of our stethoscope. We'd also turn our baby over and make sure we're listening to the back lung sounds. And then we're going to listen to the heart sounds of our babies. For our lung sounds, we want to make sure that there's no wheezing or crackles, and make note of any abnormalities. And then for the heart sounds, we're going to make sure that we don't hear any murmurs. And then we want to listen to the apical pulse for a full minute. And we would also want to go ahead and auscultate the abdomen and make sure that there's vowel sounds in all 4 quadrants. And then I would go ahead and palpate the abdomen. And then I'm gonna check the arms of my baby. So I want to make sure that they're flexible. They're not too loose or tight. And then we're gonna go ahead and assess the baby's brachial pulses bilaterally, make sure they're even and symmetrical. And we're gonna check their palmar reflexes by putting our finger in their hand and making sure it grasps around. And then we're gonna go ahead and move on to the legs. So we're gonna check to make sure our baby doesn't have any hip dysplasia. So we just lift the leg and make sure we don't, their hip doesn't pop. And then again, we want to make sure that their limbs are loose, but not, that they're flexible, but not too loose or too tight. And then we're going to check their plantar reflexes by putting our finger under their toes and making sure it grasps around our fingers. And then their Babinski reflex by moving our finger along their foot and making sure that their toes extend. And then we're going to turn our baby over and make sure we assess the spine, make sure that it's symmetrical. And we could also assess the buttocks and make sure that our creases are even. And for our genitals, we would want to make sure for a male that the penis it could be up to 2.5 centimeters long. And our scrotum, could be 1.5 to 2 inches. And then that the skin is going to be soft and rugae might be present. And then for our female babies, we're going to make sure that the labia majora is covering the labia minora. We would assess the mounds, and the clitoris could be swollen or bruised. And if there was any bleeding present, that could be pseudomenstruation, which is caused by hormones during the birthing process. And then we're going to test our baby's other reflexes. So we would assess their walking reflex. So we're going to lift our baby up, and they should, their legs should move as if they were trying to walk. And then we're going to assess their Maro reflex. So we're going to pick our baby up, and we would drop them kind of suddenly, and they should act startled. Their limbs should swell, and they should act startled. Then we're going to test our tonic neck reflexes. So we would gently move the baby's head to one side, and their opposite arm should go up, and then the arm that's on the side of where we move the head to would flail out lightly. And then we already tested our pupillary reflexes, our sucking reflexes. We would test our rooting reflexes by, again, make sure your hands are gloved, by moving our finger on their cheek, and they should move their head toward it. And then I think that's it for our baby's physical assessment. We would check their gallant reflex by moving by going down their spine, and their hips should move on that side. We would do the same for over here. And then we would be sure that we documented everything, and that would be it for our baby's physical assessment.
Hi, my name is Shelby Wages, and I'm going to be demonstrating my nursery scrub checkoff. Okay, so normally we would have a automatic SIG, motion sensor, whatnot. I'm going to turn it on. Okay. Then I'm going to wet my hand. We want to make sure we don't get our scrub uniform wet. Okay, so I'm going to take my nail kit, and under the faucet we're going to clean under our nails. We want to make sure our fingernails are no longer than the tips of our fingers. And then we're going to dispose of this in the proper receptacle. Then we're going to take our brush, and we're going to rub under our fingernails 30 times. Okay. So then we're going to clean or scrub our fingers. So we want to separate them into 4 quadrants. So I'm going to start off by doing my thumb. So we're going to do it 20 times.
then we're going to do the web 20 times. Okay, and then we're going to separate our arm into 3 different quadrants. Again, we want to rinse our sponge first. And And I would dispose of this in a proper receptacle. And then to rinse, we're going to rinse from our fingertips to our ones up here. And I would repeat all the steps for my other hand. So I'm going to grab my napkin. And you dry from fingertips to elbow. And then you would don new gloves.